Hello. Earlier this year in March, a number of the universities at the World University Network met in Cape Town, where we brought together the community on responding to climate change with those working on public and global health. Today I'm with Mark Hanson, and I'd like to discuss what's happened since that meeting in March. So Mark, what progress do you think there's been since we met in March?
Well, it's been quite a lot, I think, Guy, because at that meeting there were three groups that formed to address issues that WUN had become interested in. One was on health literacy. There was another group on migration and a group on resilience, the idea that populations and even individuals respond in different ways to the challenges of life, including climate change. Those three groups have gone on to write grant applications, to have meetings and a whole range of teleconferences. And when we meet in Hong Kong, I'm sure they'll be reporting on their progress and taking their fields forward. Hong Kong, you mentioned climate change, and of course Hong Kong's a very interesting place for us to meet again in that context, because there are many issues that concern global warming, pollution, migration to cities that are very relevant to the development of China and to the work of our colleagues in the Chinese University of Hong Kong. So I think those themes and putting them in the context of the Chinese situation will be something that we'll be able to really develop quite strongly in our meeting in Hong Kong. One of the other things, though, that was very clear from the Cape Town meeting was this question of food security, and I know we talked about that a little in relation to climate change, but have there been other developments from your side in that area?
Yes, with food security, obviously it's a big problem facing mankind in the 21st century of the rising population, and Africa is probably considered the biggest challenge of all. So many of us at that meeting are beginning to work in an African context now. Obviously, being based in Cape Town, it's a very well integrated university down in Cape Town that can work across Africa. And in fact, at that meeting, the presidents of a number of African universities met to discuss how they could become involved in the activities. Now, I can give you a couple of examples. So here at Southampton we have a couple of PhD students who are benefiting from the opportunities of visiting other universities. So the University of Bergen is very strong in working on the fish populations in Africa, and fish obviously provides key protein and essential oils to enable food security to be delivered. And those two individuals are currently in Malawi, in Africa, looking at the effects of climate change on the lake systems there and how that affects the population and the well-being of individuals in Malawi. And in fact they're going to Bergen later this year to work with the scientist who is in Cape Town to look at how fish could be an important part of food security and health in Africa. Another example is that one of the challenges is, and China is a perfect example of this, is as the country increases its wealth, they tend to switch their diet from a more vegetable-based diet to a diet heavy in dairy intake, and that can have implications if you don't manage it properly. And there's a group who met in Cape Town who are really going significant pace now at looking at how you can increase livestock production but in a more sustainable way. Many of the people calculate that when people start eating too much dairy or too much meat, that has a big implications on the environment, and it affects climate change because many of these animals produce large amounts of methane. That group are actually looking at ways in which we can make production increase, and obviously there's a wonderful opportunity to work with people like you in terms of addressing the consumer side of it, because if the consumer is changing their preferences, you don't really always want to just feed what they want, and you might want to work at a higher level in terms of modifying the two. So at that meeting, it was interesting that the United Nations FAO were chatting with the United Nations Health Organization, and it's really important to integrate those two organizations. So what's happened from World Health Organization perspective?
Well, some very interesting developments actually just over the last few months, Guy, because at the World Health Assembly in Geneva in May of this year, the Director General, Dr. Margaret Chan, announced that she was forming a commission on ending childhood obesity, ECHO it's called, and this is an unusual development, something that the World Health Organization have only really done 2 or 3 times in the past. One of the leaders from University of Auckland, of course one of the WUN partners, Professor Sir Peter Gutman, has been asked to co-chair the commission, and beneath the commission will be 2 groups reporting, one on the science and evidence on preventing childhood obesity, which I will co-chair. So I think we can take some modest credit for WUN colleagues and the collaborations that we've set up over the years in playing a role now in taking really, I suppose, our early life perspective on the prevention of non-communicable diseases, starting early in the life course and then following through with preventions in children of school age, teenagers and adolescents and young parents, all as ways of reducing the risk of non-communicable disease. But it's very interesting that World Health Organization have focused on this, something where they really want to see some real developments within a time frame of a year or so, because the reality is that every country in the world is seeing an increase in the rates of children who are overweight or obese. Obviously some countries faster than others, but coming back to your point about sub-Saharan Africa, many of the African countries are the ones where we're seeing the fastest rise in rates of childhood obesity, even though at the moment the level of affluence is low, and so this is a really challenging situation. Their economies won't be able to cope with it, and down the track the disease consequences, the comorbidities of obesity will be really quite dramatic. So I think that the opportunity for networks like the Worldwide Universities Network to link with organisations such as WHO as we move forward is really something extremely important, and we have a fantastic role to play there. Do you see then in the work that you'll be doing for the Food Standards Agency that the kind of global networking is an important activity, or do you see the role of organisations like that as more kind of country focused?
Well, obviously individual countries like the UK and that government agency's focus is on the United Kingdom population. So in my case, 55 million people in the UK having access to food which is safe and of the right standards. However, if you look at the UK food imports, then the UK imports food from 184 countries down the world, and whilst 6 countries provide the majority of that food, we know that actually globalisation is increasing. We know that there's increasing reliance on food supply chains going around the world. So in the UK and in my new role, to ensure that everybody in the UK has access to food that they know is going to be good for them, in both the short term and the long term, it's that understanding the global network that's important. And that's where it's really good to be part of a network which enables you to work in countries across the world with experts across the world. So I see the opportunity to access the wonderful knowledge base that exists within the network, interacting with people like yourself and public health doctors, becoming really, really important, not just for me, but I think in terms of people in the world as a whole, having food which is safe, the right standards, so they live a healthy, productive and high quality life. I think it's the only way forward.
Great. Well, we're busy people, but I guess we'll probably meet again with our teams in Hong Kong.
Yes.